I'm Ramnath Subaraman. I'm a faculty member in Public Health and Community Medicine. I'm the faculty lead for the TUSM Global Health Seminar Series, and I want to welcome everyone to this month's seminar. This series is sponsored by the TUSM Global Health Faculty Council and the Tufts Center for Global Public Health. So this year, we've been privileged to host a wide array of guest speakers who explore diverse topics, including M-Health for hypertension in Ghana, the public health impacts of war, One Health in Northeast India, health and community organizing in urban informal settlements, the global epidemiology of avian influenza, and discussion around advocacy related to the unparalleled crisis we're facing currently in global and domestic public health over the last few months. With leaderships of students from the TUSM Global Health Interest Group, we also had the first annual TUSM Global Health Symposium earlier this year, or last month. So I'm now happy to introduce our speaker for this month, who's the final speaker for this academic year, Dr. Hassan Khan. So Dr. Khan is an assistant professor in the Department of Urban and Environmental Policy and Planning at Tufts University. His teaching and research focus on issues of environmental justice and equity, combining rigorous systems analysis with mixed methods approaches to study water management in the global south. He is founding director of an interdisciplinary research group called the Karachi Water Project that is developing technological and policy-based solutions to urban water challenges in South Asian cities. Dr. Khan's research aims to inform discourse on water beyond a simplistic and overly infrastructure-focused centralized approach that often overlooks the needs of marginalized communities. In a parallel research stream, he develops and integrates hydrological and socioeconomic models to aid decision-making from water managers across a wide range of spatial scales, ranging from basin-wide water management and transboundary river basins to urban water system planning. He's worked on projects funded by the World Bank, USAID, the International Water Management Institute, the Belmont Forum, and others. Prior to joining Tufts, Dr. Khan was assistant professor of environmental science at Habib University in Karachi, Pakistan, and he was previously a postdoctoral scholar at Stanford University's Earth System Science group. So I'm really happy to welcome Dr. Khan and really to discuss what is perhaps the most foundational determinant of health, which is water. Thanks.
Thank you, Ram, for the introduction. Okay, this works. It's great to be here. Thank you for inviting me. I got an excuse to visit the Health Sciences campus for the first time. As Ram mentioned, I've been at Tufts for a couple of years. Before that, I was based in Karachi, where I was doing some field work related to the water and sanitation system there, and that's sort of what a couple of the studies that I'll be talking about today are going to be drawing from. So before I get into our work in Karachi, I wanted to sort of maybe provide a little bit of context to the setting. So South Asia has historically featured agricultural economies, and in recent times, there's been a shift towards industrialization coupled with rapid urbanization. This has placed a lot of stress on cities. Now, you've got a lot of people moving into cities. At the same time, the infrastructure, especially the water infrastructure and policies, that hasn't really kept up with this sort of huge influx. And so what that means is that when it comes to policymaking, cities are often treated as monoliths, right? So you've got these ideas of average water usage or average access to sanitation, which in a city or in cities with millions or tens of millions of people can mask a lot of disparities. There are huge disparities, socioeconomic disparities that exist within these cities. And oftentimes, sort of the ones that are most marginalized and most overlooked are the ones on the peripheries, not just the geographic peripheries of these cities, but also on the economic and ethnic peripheries. Now, Karachi is one such city in South Asia, right? It is a city with a population of upwards of 20 million. It's Pakistan's largest, sort of financial hub. It's the only port city, or was the only port city until recently. And overlooking sort of this entire water system for the city is one water utility, right? It's the Karachi Water and Sewerage Board. And they overlook a water system, or they manage a water system that has a lot of different challenges. First, they have what's termed intermittent pipe water supply. For those of you who don't know what that term means, it basically means sort of water is only available in the pipes a few hours or a few minutes in a given day or in a week, right? Which is different from the completely pressurized flow or 24/7 flow that we're used to here, right? You turn on a tap anywhere in Boston, you're going to expect water to flow out of that tap. That's not necessarily the case in an intermittent pipe water supply. Coupled with that, you've got aging infrastructure in the city that's not been sort of invested in, which leads to high system losses, right? A lot of leakages across the system, a lot of revenue loss as a result for the utility. This is coupled with poor water quality. You've got cross-contamination of pipe water with sewage, and so you've got really poor water quality. And sort of to really drive the point home, the utility is extremely financially constrained. We talked about sort of the revenue losses through leakages that they face, but poor billing practices, low pipe water, sort of pricing, that all contributes to utility that is dependent on provincial, bailouts every year to pay sort of their salaries, right? So forget about sort of investing in the system. The utility right now is having trouble just, sort of paying or keeping the lights on. So in this context, it's very interesting what the public discourse or what sort of, if you were to sort of talk to the average person on the street or, strike a dinner time conversation with someone about water in Karachi, the whole conversation seems to revolve around this idea of water shortages and water scarcity. That's what everyone talks about. That's what all the news outlets talk about. Sort of this is a collection of sort of recent headlines, but sort of all of them sort of looking at Karachi's water problems through a lens of scarcity and water shortages. Now, what that does is that focuses the attention of policymakers on the materiality of systems. What that means is that the solution to all of these different challenges that I was talking about just on the previous slide, all the answers lie in sort of the next block of concrete that they lay, right? Is it a desalination plant? Is it sort of a new pipeline, right? Some infrastructure, mega infrastructure project, ideally, or which a politician can plaster their name and sort of get maybe some kickbacks. But like what that ends up is that the city keeps on accumulating a lot of debt-laden infrastructure that ends up not addressing any of the challenges that I mentioned on the previous slide, right? But ends up serving a minority. And so what the work I'm going to be talking about now tries to refocus this discussion, right, of water in Karachi, but cities similar to Karachi on issues of access and equity. So the first sort of study that I'll sort of talk about explores how sort of weak water governance, essentially failures of the water utility, contribute to pushing the particularly vulnerable sections of the city even further to the margins. And we use a case study of Liari, which is a settlement in at the tail end of the water system. So just to give you an idea or context of this study area, so Liari is an extremely dense settlement in Karachi. It's about the size of Somerville, but it's about 10 times as dense. And so Somerville is, by the way, the densely populated, sort of city in Massachusetts. So imagine 10 times density of Somerville. And like I mentioned, it's on the tail end of the water system, so it's particularly vulnerable to water challenges. What we did in this work was we sort of carried out this mixed methods approach where we, sort of surveyed. We got a representative sample of households in the settlement, interviews with key stakeholders, so local elected, politicians and water utility managers, and participant observation. We coupled this with this water use questionnaire that we use to estimate, sort of people's water consumption, household water consumption, and then also complemented this with sort of water samples that we collected and tested for, sort of bacterial contamination from about 79 households. And keep in mind, these are drinking water samples that we collected. This will become relevant in just a minute. So just sort of what did we find in our work? So in this figure, what I want to do is first draw your attention to the red dots and the blue dots. Now, each dot on this sort of figure represents a household. And sort of the blue dots are households that receive water in their pipes every day, and that's a real luxury, right? That you've got water every day in the pipes. The red dots, on the other hand, are households that don't have any pipe water or don't have any pipe water connection at all. And what's interesting is oftentimes these red dots are right next to these blue dots, right? In many of our cases. So often on the same street, you'll find households that are reporting receiving pipe water every day, and 2 houses over, you'll have a household that doesn't even have a pipe water connection. That was sort of perplexing. And so we investigate that further, and what we find is that almost all of the red dots, red households without pipeline connection, are extremely poor. Now, what does being extremely poor have to do with having pipe water connection? Well, what we figured out during our field work was that the water utility, the way they operate in Liari is that they build sort of their water mains up to sort of some central point in the settlement. And then it's up to the households to connect to the water utilities bulk water line, right? So that sort of last, sort of few yards of connection is on the household themselves. The water utility doesn't connect each household. And so what we see is images like these are sort of really common across the entire settlements, right? These are self-laid pipelines. Households themselves essentially lay down that pipeline to connect to the water utilities network. Now, this requires a little bit of capital investment from households. And what you have is the really poor households can't afford that capital investment, right? And so even though there may be piped water available in their area, just because they're not able to connect to the water utilities means that they go without piped water connection. And we'll discuss what the implications of that are in just a minute. But just going back to this figure, there are others, just because you've got a pipe water connection, by the way, doesn't mean that you have pipe water, right? So the gray dots are households that have a pipe water connection, but no water really flows in those pipes. Some households get water every other day, some get 1 to 3 times a week. But in general, for all surveyed households with a pipe water connection, the median water supply was around 3.5 hours per week, right? So about 3 or so hours in a week is when water was available for these households. When intermittency is the norm, water storage becomes a very important coping mechanism. And there also we saw the impacts of wealthier households are able to sort of have larger water storage containers and are able to sort of protect themselves better against these intermittent water supply. Now, when you combine these self-laid pipelines with an intermittent pipe water supply, what you get is a lot of cross-contamination, right? What that results is in really poor water quality. So in our water quality tests that we did, about 80% of all samples tested positive for E. coli, right? So the presence of fecal coli, like essentially fecal matter in the water. And keep in mind, again, these aren't just like water sample, like this is not water that households are using to wash their cars or sort of wash their homes. This is water that households are drinking. We would go oftentimes ask them for a sample, they'd sort of open their refrigerator and pour something out for us. So this is water that households are consuming. There's an image of one of the samples that we got from a household. We could sort of visually see worms in the water, right? And you can expect sort of what kind of waterborne illnesses, the rates of waterborne illnesses, and the resultant water or sort of health expenditures that households incur, which I'll sort of talk about in a few minutes. But in general, so what we see is that only about 1 in 6 households depends on pipe water supply. The remaining resort to other sources. Well, what do these other sources look like? They come in all shapes and sizes, right? So ranging from hand-delivered water, so through mush teeth, right? So they're sort of water bags essentially that they carry to deliver water to households, versus sort of this makeshift pickup truck, that's got a water tank on the back of it. What we saw a lot in our fieldwork was how obvious or how sort of important water procurement was in everyday life, right? Like this was really a central theme that we saw all across the settlement. So a few things that we see when it comes to these alternate sources. First, So this scatter plot shows you a couple of things. One that's pretty intuitive and one that isn't. So, each dot again denotes a household. The color of the dot denotes the number of sources that a household pays for. And so the intuitive thing that we see in this figure is that as the number of sources that a household pays for goes up, their total monthly expenditure shown on the x-axis goes up, right? That makes sense. You buy water from multiple sources, you pay a lot more for water. But the y-axis shows the water consumption, the estimated per capita water consumption. And here's what's interesting is that, we would expect that as a household gets water from a few different sources, pays for a few different sources, has an increasing expenditure on water, that their water use would also then maybe sort of, accordingly go up. But that's not what we see. This isn't households buying more water so they can fill their pools, right? This is water that households are buying to survive. And so what we see is that as households increase the number of their water sources, their expenditure increases significantly, but water use does not, right? And if anything, you sort of see this sort of decrease in water use. Now, at the same time, households are paying a lot in absolute terms for water, right? Just in terms of what it costs. When you don't have pipe water, you have to get to these alternate sources that can cost, sort of ranging from 5 to 10 to 50 times more per unit of water. And here again, what we see is that sort of this part of the settlement, which by and large features sort of the poorer households, they not only are they paying a lot for water, as a proportion of their monthly income. Some households are paying over 20% of their monthly income just for water. They're also paying more in absolute terms, right? So what we see when we sort of combine these two things together, what we see is that the poorest in Liadi are paying the most for the least amount of water, which is also heavily contaminated, right? Yeah.
Very quick question. Whom are they paying money to?
So these alternate sources, these could be sort of water tanker operators or mushkis, right? Those people themselves that are, so these are sort of entrepreneurs or middlemen that sort of, they're not the ones who are producing the water. It's the water utility that's sort of still, the only source of water in the city is the water utility, because Karachi gets no rain. They sort of pump in water from about, sort of 100 miles away. They treat the water and sort of do all of that stuff. But because of that sort of last 100 yards or so that they're not able to connect the households, sort of there's a whole economy that exists to get water to households. So you can imagine sort of the different types of impacts this has on households, right? So households often describe, sort of, feelings of chaos and anxiety and helplessness when it comes to sort of this daily struggle to procure water, right? So, sort of we have, a resident who couldn't afford to install a pipe water connection, sort of talks about how getting a pipeline would make a huge difference on their lifestyle, right? They spend more water on anything else. You've got another sort of daily wage worker of the Sindhi Mahigir communities, the sort of local fisher folk community that's indigenous to this city, right? They've been there the longest, for a couple of 100 years. We wake up at 4 a.m. so that we can go and collect water. We come home around 9 and then go to work. We're fishermen and do not earn well. This wastes not only our money, but also time. So today, Liadi is fairly well connected, despite all of these challenges that I mentioned. It's sort of fairly well connected into the water utilities network, even if it means that households are responsible for that. But it started off initially as what we call an informal settlement, right? And South Asia, like I mentioned at the start of the talk, is rapidly sort of undergoing urbanization. And among other things that this has done is has strained formal capacity for housing in these cities. And so you've got a lot of these informal settlements or impermanent settlements in some places that sort of are sort of really increasing or expanding all across major cities in South Asia. So even though more than 130 million people across South Asia live in informal settlements, these settlements are often excluded from official city planning often for political reasons that encourage undercounting. Now, it's important to sort of what the implication of this sort of overlooking does is that not only are they excluded from sort of water utility planning, but they're also sort of thought of in policy circles as homogeneous blobs, right? That all experience basically similar sort of conditions when it comes to water and sanitation access. But what we see for different, anecdotally, we know at least that, there's a lot of diversity across informal settlements and within these settlements itself. There hasn't been a lot of scholarship, though that is changing. There's increasing scholarship on informal settlements, but often that too fails to acknowledge heterogeneity. So, sort of in this there's this widely cited study that compares 15 different cities and their informal settlements across the global south. And in that study, they choose what they call a typical informal settlement that's representative of the city. Right. And, sort of ideas like that are sort of very common in the academic literature. But the problem is that there isn't a typical informal settlement in a city. You've got a wide variety of trajectories that informal settlements follow within a given city, which means they have got sort of very different access to water and sanitation. So in this work that I'm going to sort of talk about next, we sort of investigate what are sort of the different reasons and determinants why there seem to be a lot of differences within informal settlements within a city, and sort of what impact that has on the people living there. So I'll sort of quickly go over some sort of the framework just to give you a little bit of context to sort of our place in Karachi again. So you'll hear this term, if you haven't already heard this before, of regularizing or recognition. Basically, this sort of means when the government, sort of provides formal legal recognition to households, sort of informal, like some sort of land tenure. A couple of things that will be important for sort of the talk. There are a couple of laws that sort of the city and the government has sort of instituted to regularize or sort of essentially govern informal settlements or Kachhi Abadis as they're known colloquially. That I'll be sort of also talking about. So for this work, where we study or where we start off with classifying settlements in Karachi. So we first start off with sort of a broad categorization of 3 different types of settlements. First, you've got these informal subdivisions. Essentially, these are vacant plots of land that some sort of, middlemen or sort of, some government official sort of identifies and then sort of moves in families on this vacant plot of land, right? And over time, sort of they sort of prepare or they work with, sort of the police or the, sort of local agencies to, sort of get them political cover. The land is demarcated based on sort of procedures followed by the city government, even though it is not done by the city government. They follow the same procedures to make it look official. And then plots are sold at low prices, and then families are compelled to come and sort of, stay here so that they can sort of establish tenure. So that's one type of informal settlement. There's another type, which is sort of, goats, which are basically, these are, sort of villages that existed in and around Karachi, which used to be sort of a small fishing port before sort of the British developed it as a port for the empire. And now these villages have been subsumed by the urban sprawl, right? So now they find themselves in the middle of a mega city, and sort of again without according change in infrastructure. And then finally, there's a third type of informal settlement that we classify, which is that's located on sort of ecologically unsafe land. So it might be on a landfill or next to a landfill, or it could be sort of on the banks of sort of an open sewer in the city, right? places where otherwise you wouldn't sort of live because of the environmental hazards. Within informal subdivisions, we categorize, or we sort of add an additional category of regularized and unregularized ISDs, right? So you've got informal subdivisions that have been regularized that meet sort of the criteria laid out in the Sindh-Kutchi Abadis Act, and then some others that have not because of sort of a variety of different reasons, either land disputes or other political challenges. And then within the regularized settlements, we sort of create another distinction between ISDs that have been regularized, sort of for a long period of time, or sort of soon after the passage of the Sindh-Kutchi Abadis Act, and those that have been recently regularized, because we wanted to sort of understand what the impact of recent policy changes or legislative changes have had on the outcomes experienced in the settlements. So we end up with sort of this classification about 5 different types of settlements that we identify for Karachi. And then for each of these types, we select an archetype settlement for illustrative purposes, just to sort of see what those different challenges end up meaning in terms of water and sanitation access across Karachi, right? So you've got Nek Mohammad Goat, which was a village that was established in the late 1800s. We've got Manzoor Colony, an ISD that was regularized in the early 1990s. We've got Qaid Azam Colony, Sherpao Basti, and then Ilyas Goat finally, which is the settlement that's on the banks of the Liari Nadi, which used to be sort of a rainfall-driven stream, but now acts as an open sewer for the city. So again, for this work, very quickly, sort of we combined household surveys, interviews, and sort of we included questions on sort of demographics, water expenditures, access to water, sanitation infrastructure, and again, estimated disaggregated daily water use. So many of the features we sort of saw in these informal settlements are also ones that we saw present in Liari as well, right? That I talked about, self-laid pipelines, limited garbage disposal, you had overflowing sewers, containers, used by households to collect water, pretty sort of dense and, sort of living, very, very sort of narrow streets. Now quickly on to sort of, what we find in terms of water and sanitation access across these 5 different types of settlements. So we see significant variation first in pipe water access. So for example, while almost all households in the Manzoor Colony have a pipe water connection, in Ilyas Goat, none of the households have a pipe water connection. What this obviously translates into is sort of daily water use, which again, sort of there's a fair amount of range in terms of liters per capita. It ranges from about 13 liters in Ilyas Goat to about 37 liters in Manzoor Colony. Now, keep in mind that even though there's this variation across the board, this is extremely low. Sort of give you some context, 50 liters per capita per day is proposed as a bare minimum in by Glaika et al. And I quote, prevent human misery and suffering. So you need about 50 liters per capita per day for that. WHO guidelines state that in the aftermath of humanitarian emergencies, right, earthquakes, floods, that sort of refugees be provided with at least 15 liters per person. But we see in Ilyas Goat, even sort of that level is not met for everyday life, right? And this is sort of their everyday living. These aren't sort of one-off conditions that these residents are living in. Water procurement, we saw that sort of households didn't have to travel long distances to procure water, but this accessibility came at a steep cost, right? So again, water expenses comprised a big percentage of monthly income from households. In terms of water, in terms of sanitation and health outcomes, so we had high levels of incidence of contaminated pipe water, right? So cross-contamination of water, either households could smell or visibly see, contaminated water. And it's no surprise then sort of that the incidence of waterborne illnesses, right, in the past 2 months were really high, right? So about, sort of ranging from about, sort of 50 or 60% of households up to 73% of households in Ilyas Code mentioned a waterborne illness in the past 2 months. And, sort of different types of illnesses that households report, right? Sort of ranging from sort of basic, sort of diarrhea and fever and, sort of malaria, gastrointestinal challenges as well, and which obviously sort of relates or results in high monthly health expenditures as well. So this initial snapshot, sort of shows us a couple of things. First, that there's poor levels of wash access across informal settlements, and that there is some variation in this access across these settlements. Yes.
I was just curious what the explanation is for there being such a high the waterborne illnesses in Ilyas if there's no water.
Yeah, so that's a great question. So because they don't have like pipe water connection, they have to sort of often travel to either the sort of nearby neighborhoods to collect water, or sort of like I mentioned, they're sort of oftentimes on the outs or like right on the bank of this open sewer. Oftentimes, sort of in the absence of other water sources, we sort of households reported making use of water from that sewer as well. Yes.
I'm just intrigued by the numbers of the pipe water connection between the recently just regulated and the unregulated.
Yep.
What may be driving that?
That's a great question. That leads me to this next point, right? So why is there this difference, right? What's behind sort of this difference across these informal settlements? And so the first one that we see, obviously, sort of regularization plays a role. Manzoor colony that was regularized a long time ago tended to feature sort of better access to water and sanitation. But we also see that is not by itself not enough. Like you pointed out right now, that you've got a recently regularized settlement that is actually not doing that great, and you've got unregularized ISDs that are sometimes sort of doing much better off. And so regularization has a mixed impact, and the reason for that is sort of these uncoordinated institutional changes. See, so what happened, and sort of I'll just use this quote by the city government official that sort of helped explain this. Basically, they said that before 1996. Water and sewage services in Karachi were managed as part of the city government, right? So the KMC. The KMC was also involved in the land acquisition process for regularization. So when the regularization was happening, KMC would take care of the water and sanitation issues in terms of pipe water connection and so on. But in 1996, you've got this new entity, the Karachi Water and Sewerage Board, that I talked about at the start of the presentation as Karachi's sole water utility, that was formed as a separate entity. And it meant that, sort of it was no longer part of the regularization process. Now, keep in mind that the law for regularization was passed in 1987, the Sindh-Kachhi Abadis Act. Under that law, there is no specific provision that says that, as part of regularization, water and sanitation services need to be provided. But that was because KMC at that time, right, the city government at that time, was taking care of the regularization. They were doing the water and sanitation anyways, and so they were able to address that. But once we had this water utility formed, nobody sort of thought to go back and sort of change something about sort of laws and include specific legal provisions in the existing Sindh-Kachhi Abadis Act, right, where sort of these provisions could be established. So as a result, recently regularized settlements don't sort of have any guarantee of access to water and sanitation. They sort of get legal tenure, but sort of water and sanitation services don't come as part of that. We also see sort of other factors such as age of a settlement, right? So the longer a settlement's been around, right, sort of they are able to accumulate sort of political and social capital, right, and over time build up that settlement. This is something that sort of really came across in our interviews that households sort of identified as a reason for things improving in their vicinity, right? We also see sort of location and household wealth plays a role. Household wealth actually plays a pretty smaller role than we thought it would within a settlement, right? We see that sort of wealthier households had a slight statistically significant advantage when it came to accessing water, but this advantage did not extend to sanitation infrastructure and services or outcomes. So I'll sort of wrap up here. Sort of where, sort of some of the things that we want to take away is like tying it back to what I was talking at the start, right? About that for most of Karachi's residents, water supply per se is not the only problem. Not contending here that it is not a problem, but it is not the only problem, right? Which means that, sort of if all your policy solutions and interventions are going to focus only on scarcity, you're going to overlook issues of access and equity, right? So think about Liari, for example. You could lay another bulk water line in Liari, right, and double their water supply. The red dotted households that we saw in that map are still going to remain without a pipe water connection, right? And then finally, we see that sort of poor water and sanitation access is costly and acts as a major reason why households are trapped in poverty. All right, I'll stop here. Thank you for your attention, and I'm happy to take any questions.
So we're just going to take a second and get the floating meeting controls back for which I have tech support so that we can also get questions from our online audience. So for our online audience, please feel free to start putting questions in. We are trying to be able to see you. But while we're doing that, I'm just going to take the privilege of asking a question. And I think the question, I have a couple of questions. I'll save one maybe for the end, but one of the questions for me, so I do work on water in urban informal settlements in India. And it's sometimes really hard to communicate the sort of foundational nature of those challenges to people here because it's almost unimaginable to us. How do we can't, when we are using upwards in the 300 to 500 liters of water per day, we have no concept of what it means. How do you deal with that struggle of communicating to an audience here what it means to have 30 liters, 20 liters, 10 liters?
Yeah, that's a great question. And sort of, I teach a course on the Medford campus on water, and one of the things I do, I have students do in class is I have them keep a water journal, right? And because this is something that oftentimes we like, any of us, like we don't really have a good idea of what our water use is. I think you have somewhat of an idea of your electricity usage or gas usage because maybe you sort of often see that on your bill. But with water, we tend to sort of not really have an idea of what we're sort of using water for. And I think I think we just struggle with water literacy in terms of just understanding the numbers themselves. I think, sort of putting things in context of, sort of an average shower taking something around 50 to 100 liters, sort of what does it mean if your total daily water supply or available supply is about 30 liters? What does it mean in terms of, sort of hygiene impacts, right? What does it mean in terms of, sort of health outcomes, missed days of work, missed days of school, right? Stuff like that. I think those are the metrics through which people sort of are better able to sort of understand those impacts. But yeah, I mean, it's a completely different paradigm to sort of talk about there.
Do we have questions here? So I'll start from the back.
I don't know if I missed this, but when you tested the water, was the water that was piped in generally cleaner or safer than the water that people were buying? It didn't seem like it.
That was a great question, and that was actually the reason why we went ahead and collected these samples. That was like water quality testing and sort of sampling and testing was actually the sort of a big challenge, so the surveys were easy. And that was exactly the thing that we were trying to test was how sort of do different sources of water end up sort of looking like in terms of water quality. And sort of I don't know sort of at what point you came in, but like 80% of samples had E. coli, 92% had presence of coliform bacteria, right? And so that kind of sort of ruined our whole study there because we saw across the board, it wasn't, we had samples from sort of reverse osmosis plants that, are set up that are supposed to be sort of, super treated water or sort of really good quality water, ranging, and groundwater and sort of water tankers and so on. But across the board, we saw such high levels that they were not statistically distinguishable. And a big reason we sort of identified there was actually the source of contamination. In addition to sort of that cross contamination between the pipe water system, was often the storage containers themselves, which kind of sort of rendered any treatment that was done before that sort of invalid. But yeah, great question.
I was gonna ask a similar question, but a different question that I had. You had like the per month salary that people are spending on water percentage. Do you know how much, how much the initial sort of pipeline connection to the pipeline costs?
Yeah, so just to, yeah, that's a great question. So in terms of numbers, you can sort of think about water expenditures ranging on the order of about a couple of thousand rupees, right? And you can sort of think of household incomes on the order of about 20,000 rupees or so at the time that this study was done. So about 10%, 10 to 20, some households that were paying 5,000 rupees a month, they were paying a big proportion of their monthly incomes. The capital expenditure ranged depending on how far or sort of near to the water bulk line you were situated, right? But it could range, but sort of the lower end of that range was tens of thousands of rupees, and could go up to 100,000 rupees if you were sort of really far away, or if you wanted to lay down a bigger pipeline. Those expenditures were typically by higher income households who wanted sort of a bigger pipeline that could sort of get them a higher volume from the city's network.
Is that like the whole units? Like the
Yeah, so that's again a great point. So in many cases, you do have sort of how HOA type situations, right, where you've got sort of a building and it's got sort of 10 different households and they sort of all pitch in and do that. But in most cases, it's individual households doing that.
I have just a quick follow-up question, a different one. If all the water is contaminated, you as a researcher and people coming in, is there guaranteed safe water for people to be drinking when you're there as a visitor, or?
No, it's not. And this was so a lot of my field work that I did with sort of a lot of the undergrads. I was at a liberal arts college, and so sort of a lot of our researchers were students. And for them, it was sort of, because Karachi is such a big city that for many of these students who were typically from generally, sort of not from informal settlements, for them, this was sort of a different type of experience. And so, they would sort of bring the water themselves, but we would end up in situations where hospitality is huge, a big deal in South Asia, right? And so you would have households who would sort of, we would go in for a survey. Not only would they agree to give us their time to do a survey, they'd be like, we'll sort of serve you tea, or we'd let us serve you something, right? And sort of oftentimes once the students knew what the water quality was like, right, they were sort of concerned about sort of how do you sort of politely refuse. Oftentimes they would sort of say like, I'm fasting or something like that, where we sort of avoid those situations. But yeah, I mean that was a consideration in our fieldwork.
I'm just thinking of with like this research with being centered in so many communities that have similar situations of issues with access to water, and how you're saying it's something we don't see here, but at the same time there is ongoing research and knowledge about the Colorado River drying up and what that will mean for the US over the next 50 years or less. Do you see collaboration coming and people having interest in this research for those reasons?
Yeah, so great point. So it's actually so there are informal settlements in the US too, which comes as a surprise to a lot of people, right? You've got these colonias that have been sort of set up across oftentimes the southern border, or sort of in tribal areas where access to water and sanitation isn't the way we sort of are used to in the US, or we think is universal in the US. So that actually exists, and that is a growing area of research where sort of, and this is like we're talking millions of people in the US, right? At least a few million who are in these sort of settlements within the US. And so this work is sort of pretty relevant in that context as well. And there are collaborations between people, because you've got a lot of this sort of knowledge from the global South, that is now all of a sudden sort of, more relevant in the global north than it has been in the past.
As Ram already mentioned, we have also been working on similar topics, particularly around global security and principles. And most of the content you shared is very relevant and I could resonate with it. I'm very curious about some of the methodologies you use.
Yeah.
And I think one major question, and I have more which I can ask later, but the settlements that you selected, what was your process of selecting those settlements? I'm sure there are more, that the pool that you had was bigger, and was there what went into the process of choosing these settlements?
That's a great question. So part of it was, sort of convenient sampling, and then part of it was just sort of logistically. There are some places, sort of we had sort of safety considerations. Oftentimes, you've got some settlements where, sort of us going in doing surveys may not be sort of something that was something that would be even allowed either by the state or by sort of the local communities themselves. And then actually sort of the impetus for a lot of this work for the selection of this settlements actually came from recent World Bank work in Karachi, where the World Bank is sort of really trying to invest a lot in the city's water system and its informal settlements. And so they had sort of this short list of settlements that they wanted to focus on. And so a couple of the settlements that we chose were based off of that short list. And what that sort of helped us with was we had sort of better idea of sort of the populations in those settlements that we needed to sort of get an estimate of, what a representative sample there would be. And in some cases, it was like, where could we find the community mobilizers? Because we couldn't just sort of go into these settlements ourselves. We needed to find sort of community members who we could work with, who we could hire, who would then sort of, help us with that. So it was sort of a combination of a few different things for each of the 5 different types that we identified to find a settlement to work on.
So I just want to sort of close with sort of a big picture question, if there aren't any questions online, which I don't see. So folks online, please feel free. We have a couple more minutes if you want to put in a question in the chat. Or is there?
Doesn't look like. Oh,
yeah. Oh, okay. So this one. Are the local authorities, so let's switch to online. Are the local authorities or politicians in Karachi amenable to discuss and consider issues of access and equity? How do officials view this?
Yeah, that's a great question, right? Because it's sort of like, I started at the start, I sort of talked about, how mega infrastructure projects are what gets politicians' attention, both because of, sort of personal benefit that they can get from, like, again, sort of put your name or face next to a project, it'll help you get reelected, or sort of other financial kickbacks that you can sort of benefit from. So getting them interested in issues of equity and access on its own is challenging, but when you sort of, the way to get their attention is sort of, to put it in terms of number of votes, right? In terms of elections, right? And which is what which is a problem also, both a problem and a solution. It's a problem because then essentially what that means is water and sanitation access becomes a politically, it's a tool that's used for sort of, building or developing political support. But in the absence of any laws or the role of the water utility to provide that service, that really is left with as the only solution for ensuring that these residents have that supply. But it's a challenge. It's a challenge because it's a change in mindset, not just for water and sanitation, but generally sort of infrastructure tends to be something that people get excited about, not just in South Asia, right? But even in the US, right, where we struggle with a lot of our civil infrastructure, right, in terms of bridges and roads and sort of highways and all of that. I mean, that's because, sort of the regular aspects of maintenance or sort of access and equity aren't as immediately obvious than like, you know, a new shiny new sort of project that sort of gets built. So yeah, so that's sort of a challenge.
So I just want to close with like
There are a couple
is there
more that
a
are
couple more?
starting
Oh,
to-
great.
We've started
All right.
now that we're
Now that we opened up.
yeah.
How difficult is it for someone without regional expertise to get involved in such a project?
Yeah, I mean, it would. So the whole reason actually sort of why I spent 4 years in Karachi was because when I wanted to study the city's water system, I was very interested in, it was very clear to me that I couldn't do that, you know, sort of without being present in Karachi. And big reason for that is oftentimes like a lot of the data sets. So I guess cards on the table. I'm not a doctor, right? Like I'm an engineer. I'm not even a sort of social scientist, right? And the reason I actually did a lot of this field work was this is not what I'm trained in, right? I'm trained in actually building computer models. I build computer models that can sort of help, you know, sort of tell us whether we should take policy action A or B and what kind of sort of, you know, sort of mathematical outcomes that sort of comes out in. But to build my models or to actually sort of run those models, I need data. And data didn't exist for Karachi. And so this was my effort to kind of sort of build those data sets that I could use, which is now what I'm doing in terms of sort of building these models. But to sort of that question of, you know, how difficult is it without, you know, sort of regional experience to get involved? I mean, I think sort of the best way is to connect with local researchers, right? So over the time that I was able to spend in Karachi, I've now sort of built a network of, you know, sort of local researchers, local community organization, just, you know, local community mobilizers, right? Who you know sort of are I can then sort of work with and continue sort of because we've got a lot of our work that's continuing now. So now I'm able to do that, but I think you know that was only possible, while you know after having spent some time there, and so you know sort of getting involved with people who have sort of work going on. So now I've got students, right, who have grown up in Massachusetts, but are now working on sort of South Asia water challenges. And I know sort of you've got students that you're working with as well, Ram. You know, so you know, so connect with someone who's got, I guess, those connections to do that.
So just to close, I mean, you know, the thing that strikes me about your work is how central it is to the very nature of cities, right? Of cities in the global South. To sort of legal and social exclusion of populations, which gets represented through water, right? Which is maybe the most fundamental need for certainly for health or even just for any sort of well-being. And so I guess that the sort of question I have is around the question of inclusion and what it means. So you talked about authorized, unauthorized, regularized, non-regularized. And first of all, how is that extended? How is that decided? And then as a second part to that, this question of tenure and other stuff, right? So oftentimes there's this suggestion within the literature that everything is linked to tenure. And I think from what I take away in the situation, and at least in Karachi in this situation, it's not linked. In fact, water access and access to maybe other things is not really linked to tenure. And they in some ways mean two different things. And I'm wondering what your take is on both of those questions.
Yeah. So yeah, I mean, maybe I'll start with the second one first. Yeah, absolutely. So land tenure is neither a guarantee nor a prerequisite for access to water and sanitation, and that's true now, especially with sort of Pakistan has also in the past couple of years been one of the most rapidly growing solar energy markets. And so what you now have is a lot of these populations across cities who have been disconnected from, you know, sort of the state and its sort of provision of services, whether it's water, sanitation, energy, garbage disposal, all these things. Essentially, you know, you've got households or communities who figured out that they're on their own and they've got to figure out this solution for themselves. So the solar question is that, you know, households who've never had the grid extended to them now don't need the grid extended to them, right? That they have to figure out sort of or solve their need there. So what we're seeing more and more is that land tenure isn't a sort of a guarantee or even something it does help, no doubt, in some other aspects and in some cases with water and sanitation. But we've seen like stuff like where are you located? If you're located next to an affluent neighborhood, right? It doesn't matter if you're regularized or not. You can sort of connect to the water utilities network there, quote unquote, illegally, right? The water utility oftentimes knows and turns a blind eye because they know that, sort of people need water and sanitation. And if they were to, and it technically doesn't require the water utility to do anything. And so they look the other way. Now, sort of to your first question of, sort of inclusion, and, sort of the role, legal, sort of tenure.
Who gets regularized?
Who gets regularized? So there's the answer that exists on paper. So the Karachi Abadis Act has a clear set of criteria. Right? A settlement should have 40 or more households built before the year 1985. Then that was changed to 1997. Then that was changed to 2012. Right. So it's a fluid date, cutoff date, and is not sort of 3, 4, 5 things. They've got sort of stuff that's sort of listed out like that. Now, in theory, any settlement that sort of satisfies those claims or those that meets those criteria is able to do that. But that's obviously not sort of what happens. Oftentimes, again, you've got sort of political expediency, right? So if you can find a patron, a politician who can sort of advocate for you and who needs the votes that your community can provide, then sort of you get the legal tenure or sort of regularization. Otherwise, you go without, which is a big problem because informal settlements haven't stopped since 1985 or 1997 or 2012, right? You've got sort of waves and waves of the different events, right? Now with climate shocks, flooding, sort of there were mega floods in Pakistan a couple of years ago. Again, a huge influx into Karachi. And you've got informal settlements now that, at least according to law, have no chance of getting regularization.
Well, on that note, uplifting note, we're glad that people like you are working on these questions of social inclusion, right? Because otherwise, it can often feel hopeless. And this is really the foundation. This is often the majority population of many cities in the Global South. So thank you for doing this work, and thanks everyone for attending the Global Health Seminar, and thanks to the online audience. So sounds just